These 5 back pain myths can make pain worse. If you suffer from low back pain, you may think avoiding certain activities can keep you safe, but in reality, you may be following bad advice that can make things worse, not better. Like, have you been told that you cannot lift anything because of your back? I'm about to debunk that myth and 4 other common myths that keep people in pain. We'll look at the science, and for each myth, I'll share with you practical tips to support your recovery. Hi, I'm Dr. Brosh. I'm a physician and educator with 20 years experience, and I'm also a recovered pain patient. Treating pain is what I do full time. Have you ever tried adjusting your chair endlessly just to try and find the right position that will help your back? Or have you been trying to find the perfect ergonomic chair that can resolve the pain once and for all? If you've done that, you're not alone. Many people believe that more sitting causes more pain and less sitting causes less pain. And many professionals too, and I used to believe that as well. So in 2018, I was working on my first book, and I remembered how 4 years before that, I still suffered from my pain and went to the other side of the city to this huge hall of chairs and simply trying to find the one chair that will save me from my pain. Of course, it didn't do that. I still enjoy sitting on it because it's comfortable, but it didn't resolve my pain. So while writing the book, I wanted to show readers the most up-to-date data that we have regarding sitting and back pain. And I started diving into the medical literature. And I'll share with you honestly, I was expecting to find many scientific studies that are linking more sitting with more pain and less sitting with less pain. But I was so surprised to find none. There were no scientific studies. There was no evidence that sitting causes more pain. So that, of course, was a turning point for me, and I started explaining that to patients. And you know how it is with sitting and back pain? Some people are afraid of wooden chairs, some people are afraid of the driver's seat, some are afraid of the airplane seats, and some are afraid of red colored chairs. So for each, it's a different sort, it's a different type, but what's common is the fear of sitting. So once I've started explaining that to my patients, they started letting go of this fear and went back sitting at home, at the office, in the car, on airplanes. And as the fear was released, the more comfortable they could feel while sitting. So here's a practical tip for you if you're still afraid of sitting and you have back pain. Go back sitting, but do it very gradually in a controlled way. Pick, for instance, a chair you feel comfortable sitting on and try to sit a second more, half a minute more, 1 minute more, and then expand it, experiment, try other sits. Control the time you're sitting, control the type of chair, control the situation, but don't be afraid of it. Over time, you will see that you will get more comfortable sitting and the fear gradually leaves you and vanishes. And of course, always mix it with standing, stretching, moving around, not because you're afraid of back pain, but simply because it's healthy. So after understanding that this was a common myth, I was beginning to wonder what other activities are feared without a cause. You know, this is something that most people with back pain miss. There are many activities that we are afraid to do, even though they're not really harmful to our back. One of them is running. You've probably heard this too. Running hurts your discs. It is said so often that it is taken as a fact. But is it really? When I suffered from the pain, one of the most things that I missed was running. I really love running, and not being able to run was really hard for me. I missed being outside and enjoying the fresh air, enjoying the movement of the body and this feeling of vibrancy and health. But every time I was even thinking about running, I would immediately twinge because I was so afraid that it would worsen my pain. And that fear alone kept me stuck for months and months. We know that for over 20 years that fear of movement and avoidance of movement make pain worse. So when I started feeling better, one of the first things I went back doing was running. And I didn't start very intensely at first. I simply circled our house. It was a 4-minute, very light jog, and it was completely okay. But then I got really curious. Remember sitting? Now I was wondering whether running is also proven to cause more back pain. And I started checking the medical literature, and if sitting was a shock, and if sitting was a surprise, this was a huge one. What I found is that there's no evidence that walking or running or jogging actually causes harm to the back. I found the opposite. I found the contrary. What I found is studies that show that people who either run for long distances, jog, or simply walk briskly have healthier backs and suffer from less low back pain in comparison to other people. And then I found another study that showed that running or walking for longer distances actually strengthens the discs in our back. A complete opposite of what I was expecting. And by the way, while preparing this video, I bumped into a post of someone who could swear that he healed himself from back pain through running. So if you've been holding back from moving more, know this: you don't need to wear your trainers and simply go on a 5K intense run. You can start by walking. Do it in a way that feels comfortable for you and increase the length and time each time a little bit more. So if sitting appeared to be unharmful and running also doesn't cause harm, I was beginning now to wonder what other activities could actually be harmless and thought of as dangerous. And then another very common sentence came to mind: lift from your knees and not your back. A quick note: if this resonates with you, check out the Healing Starter Kit below this video, link in the description. You know that moment when you drop something like a pen or your smartphone and your instinct wants to kind of really pick it up quickly, but then if you have back pain, you begin to be afraid. Will I hurt myself? And most people will bend with their knees, pick the pen or smartphone, and get up again. But do we really need to do that? Do we really need to be afraid every time we simply drop a pen or a smartphone or a small object that we will hurt our back? So at a certain point I was starting to wonder about this too, and I looked into the medical literature, and again, to my surprise, there was no evidence that you have to lift with your back straight instead of bending your back and simply picking up whatever it was that fell on the floor. And I wanted to test it if it will be okay, but then there was a small but very significant fear. I was afraid of the popping sounds that sometimes come out of the back. But then two new studies came out around the same time that showed that these popping sounds are actually signs of normal, healthy joints. These are simply tiny gas bubbles that nourish our joints, and they do not indicate that there's any harm. So after clearing that fear as well, the road was open. I started bending to lift things simply the way I wanted. Of course, if you're trying to lift heavier things, if you're a professional weightlifter, or if your profession, if your work requires that you lift heavy things all day long, you have to make sure that you're using the right technique. And many times you will need to lift from your knees and not your back, simply because the weight is so significant and you're doing it repeatedly. So make sure your technique and posture are good. So now that we've cleared three big myths: sitting, running, and lifting, now we get to the really big ones. And this is something most people with back pain, and actually many professionals, get wrong. We're talking here about a belief that is so deeply ingrained it is taken as a life sentence. And here it is: if you have a bulging disc, you are doomed to a life of constant pain. Let's separate myth from truth. Bulging discs sound very frightening to many. Picture this: you've done an MRI or CT scan and now the results come back. You get the report and you read there, black on white, a bulging disc. Many people would freeze and be very afraid of those words. And then you read on and you see degenerative changes. Those are very frightening words. Just this week I met a 20-year-old man who was diagnosed with a bulging disc by an orthopedic doctor, and the doctor told him, "Welcome to the club of disc bulges." And this young man shared with me how heartbroken he was when he got this diagnosis, because he was sure he's doomed to a life of constant pain. But then a very important question needs to be asked. Does he really need to be heartbroken? Or is he really going to suffer all his life from his back? If you'd asked me that 20 years ago when I just started, I would have probably said that yes, he is going to suffer all his life and he will need to be careful with his back, not to worsen it. But then came two very important scientific studies. The first one is a 1997 study that tested 100 people without back pain. They simply took 100 people and did MRI scans of their back. What was found was amazing. The majority of them had at least one bulging disc, and many of them had degenerative changes. These words could be very frightening, but this study showed for the first time that those changes, in many cases, for many people, are simply the changes of age, normal aging processes. Then in 2017, another bigger study came out and showed similar results. Now they didn't test just 100 people, but thousands of people over many studies. And they showed as well that most people without back pain also have at least one bulging disc and many degenerative changes. So what it means is that having a bulging disc doesn't automatically mean that you need to suffer from a lifelong of pain. It means that in most people, those bulges and changes are actually changes of the age. And this made me change completely how I address bulging discs. For me today, most bulging discs are normal aging processes. These are things that happen the more we age. And if you do have a bulging disc, have a conversation with your doctor. Ask them simply and directly, is my bulging disc something I need to worry about, or is it simply a sign of my age? This one simple question can change entirely how you treat what is shown on your MRI scan. Of course, always do it with your doctor. But then, if we treat bulging discs as dangerous, when we see that in many cases they are simply harmless, we also address movement as if it is very dangerous. So many people who suffer from low back pain think they need to move less in order to feel better. This was the advice in the past. And this is something that most people with back pain miss and do the exact opposite of what can help them. Movement isn't harmful for the back. It's actually healing. Picture this, you went to the gym or went out running or did an activity and you feel it was too intense, and a day later you're beginning to feel your back. And then you start feeling that your back went out again. So what you want to do, or what you want, is to get out of this episode as fast as you can. And here's a big mistake that many people do. In the past, we used to recommend bed rest for low back pain attacks. But this advice was actually proven to be less effective than the newer advice we have today. The neuroscience says that if you want to release yourself from the acute episode of pain faster, a better strategy would be to first rest as much as needed, a day, 2, maybe 3, but then gradually integrate movement as fast as you can, and it will help you release yourself from pain faster. So if you need, take a little rest, let yourself recuperate and relax, and then when you feel comfortable, when you feel ready, as much as possible, as fast as possible, start moving again. Start moving your body, start moving your back. It will help you release the acute attack of pain faster. As you can see, knowing exactly what to do if your back goes out is really, really important. It can really make the difference between a prolonged episode of pain or getting out of it quickly. If you're still confused about what to do in your next attack of pain, I've also prepared a video that will explain to you the right strategy that can release you from the pain faster. Watch it here.